To start, I think. So welcome everybody to the May meeting of the Medical Surgical Society for Bristol, and it's great to see your presence virtually online. There will maybe be more people coming in. So normally what we do is we ask you all to turn off your microphones and your videos. So I think nobody else has their videos on actually, so that's fine, but just if you could turn off your microphones as well. And then we've got two speakers this evening who are going to talk about their times when they were Bristol medical students. So Catherine Coulson is a retired colleague of mine. She was for many years as an associate specialist in reproductive medicine, working in the originally the Bristol General Hospital and then St Michael's Hospital and in the university's IVF unit. And she'll be followed by Mel Griffin, who I taught when she was an undergraduate. But Mel is now a consultant obstetrician with special interest in maternal medicine and is responsible for undergraduate teaching in obstetrics and gynecology in the university. So it's a real pleasure to have both of them as two colleagues that I know well coming to speak to us. And Catherine is going to speak first. Mel will speak after her. And then if there are people, if people want to ask questions, then we'll do that at the end, if that's okay, and give people plenty of time for questions. So if you would like to start, Catherine, so you can share your slides, then you can get going whenever you're ready. So I'm going to mute myself now. Oh, and I would just say some of Catherine's slides I've noticed you may need to scroll up and down a little bit on the screen to see them in their entirety. But if you can't see everything, make sure that you're just making sure that does happen. So off you go, Catherine. Sorry, thank you for that.
Okay. Well, thanks very much, David, for asking me to talk about my time in Bristol Medical School. It seems a long time since you asked me. And of course, because it was a long way in the future, I said yes, as you do. So why Bristol? Well, I have to say that I didn't really have any choice in the matter. It was totally accidental. My careers advice at school was rubbish. I think if anybody had asked me, even at the age of 16 or 17, whether I wanted to work in a laboratory or whether I wanted to be with people, I would have been able to say people even at that age. I thought about medicine, but I had two older cousins and a boyfriend at the time who were doing medicine, and I thought I wanted to do it just because they were doing it. So I chose the much more suitable option for a woman of pharmacy and went off to Manchester and started. Well, about 3 weeks into the course, we were having a pharmacology lecture. This was in the medical school at Manchester, and there was this amazing sort of deep, wooden, very, very dark, old-fashioned lecture theatre where they used to presumably cut legs off so that with everyone watching. Anyway, this lecturer said, I don't want any frustrated medics on this course. If there's any frustrated medics, they'd better get out. And I thought, oh dear, I think that's me. So I went along to the dean of the medical school and I said, I'd quite like to do medicine, please. And he said, well, I'd rather have a man than a woman. And I'd rather have someone straight from school than from another course. I could fill my course with people from other courses. So on your bike, really. So I had to go back to school which was an uncomfortable thing. I was made to feel a bit stupid, and I had to put in another application through UCA. And almost immediately the postal strike struck. And I'm not quite sure how long it lasted, but it seemed to go on for ages and ages. And I don't think anybody heard anything at all until about the March. I accompanied my application, well, in March, whenever it was the postal services opened up, with a letter to every single medical school in the country, telling them how terribly keen I was and what an excellent student I would be. And then, anyway, I didn't get any offers. I don't even remember if I had any interviews. And then I sent another letter to every medical school in the country at the time of clearing. And I remember my friends and we were on holiday and we kissed the letters goodbye as we put them in the letterbox on the Cobb at Lyme Regis. Anyway, that didn't work either. So I went off to Manchester, and I hadn't really, for my second year, and I hadn't really expected to be there. So I hadn't got anywhere to live, and I was camping on friends' floors, and we had to register in person. Well, I'd no sooner gone than Mum got a telephone call at home saying, "We've had a change of scene here in Bristol." That was an incredibly hip thing to say. And this was from the admissions office. And she had the terrible job of trying to find me. She didn't know whether I was going to ring home. They didn't know where to write a letter to me, and finally managed to get through to me through the admissions officer at Manchester. Anyway, I came to Bristol, I had an interview, and I think they were interviewing about 9 of us for 2 places, and happily I got in. It was a very different time then, and I'm just stating it. I mean, we all know that. The dean of the medical school in Manchester, what he said was just normal, and I didn't take offence at it. Another thing that happened, we were being taught a neurological examination during clinical, and I was the patient and he was teaching us on the cranial nerves, and all was going well. And it suddenly occurred to me that this man, who was old enough to be my father, was flirting with me. And I clocked it, and perhaps we changed our behaviour, I don't know. It didn't matter, but I know that you'd get into terrible trouble now if you did that. There are no photos. I mean, I was really looking for photos of my time, and apart from a few formal photos or ones that really aren't worth looking at, I've got nothing. So this is a couple of random girls who were dressed as we would have been dressed, in loons, dubious fur coats, long hair, lots of dark eye makeup. There were no phones, you know, if we wanted to, there was one phone on the corridor in Baydock Hall where I was. Correspondence was by letters. The other thing that I noticed when I was thinking about is that I had very few role models in medicine. My cousin, who's 5 years older than me and was a radiologist, she went to Liverpool and she was one of 7 out of 100 women. So 7 women out of an intake of 100. It was more like 45%, I think, in our year. So things had changed a lot in that time. But as in terms of consultants, well, there were a few rather tweedy GPs and family planning doctors. There were some obstetricians, Mrs. Midwinter, Mrs. Grenfell, and I've forgotten their names, Gillian Turner, and Beryl Corner, a diminutive paediatrician behind the wheel of a very, very large Mercedes car. There's fashion. That's myself and my husband dressed up in a middle-class hippie manner. The medical school itself was, as it still is, except it's not quite the medical school anymore, situated in University Walk. And I remember going in through the doors and it was dark and woody, and there was E29, that was the lecture theatre where we had a lot of our lectures, and I don't even know whether I've been in there since. I might have done. Chemistry building where we had these massive biochemistry lectures on for about 300 people on a Saturday morning at 9 o'clock, which was pretty painful all round. And we had some lectures in the lecture theatres just off St Michael's Hill. The top of the medical school was the dissecting rooms with that familiar smell of formaldehyde. Down in the basement were some physiology laboratories. It was a nice library. I expect it's still there, but I'm not a great one for medical school libraries, which was a nice place to work. And I do remember when we were in there, in the foyer of that medical school, when the clinical students came in, they seemed incredibly old. A lot of tweed jackets, quite a bit of pipe smoking, and they looked very old. And I expect they thought we looked pretty young as well. The first year of my preclinical was, the soundtrack to that was Rod Stewart playing Maggie May, singing Maggie May, played on the jukebox at the Colston Arms, where we'd often go for lunch. I loved behavioural sciences. I don't know whether they still teach behavioural sciences, but I loved it. We did stuff on the evolution of man. We did behavioural stuff looking at death and dying and drugs. We learned a little bit about psychotherapists. We learned about Michael Barland and the doctor and his patient and the illness, which is actually the basis of the Institute of Psychosexual Medicine, that is an organisation very dear to my heart. And the anatomy, with all that sort of dissecting room humour that gets you through it. Histology, I remember the textbook Bloom and Fawcett had very, very shiny pages, which made you go to sleep. Pharmacology was interesting. Physiology, I remember very happy afternoon while we studied the physiology of drinking alcohol and taking each other's blood pressures and other things. And bacteriology, and Prof. Speller, who dreamed of finding a bacteria which he would call Spellerella. We were encouraged to do some volunteering, and we would, in that first couple of years, and we'd sometimes go out, well, about once a week, we'd go out to Glenside, which was then still a bin, to talk to the inmates. And I remember, I have a very striking memory of an enormous open space, a closed ward, I think, with people doing funny walks and displaying really institutionalized behavior. And one of the medical staff, one of the nurses, telling me that one woman's only psychiatric illness had been to have an illegitimate baby when she was 16. We also went to Stoke Park, that someone mentioned just before we started, where there were children with special learning needs. Not that we called it that, but we weren't very politically correct. And we used to take them swimming. And I remember thinking that the water wasn't very nice when we got out of it. I loved clinical. I can't say I blossomed because I don't think I was ever a particularly clever or good medical student, but I found the method of learning really good for me. If I could hang it on a patient, I would be fine. And in retrospect, I think a problem-based learning course would have suited me very well. The firms that we were in sort of ranged between about 7 and 10 people, and we loosely held together, although they sort of rather inexplicably changed 2 or 3 people on the firm from now and again. And it was our job to take blood, and we learned. I feel sorry for the patients, but we learned. I still remember the name of the first man. I suppose I shouldn't say his name, but I remember it, and taking his history on a ward at Southmead. He had cancer of the stomach and he was about to undergo a partial gastrectomy. I had a lot of on-ward teaching. They weren't too hot on dignity then, on the dignity of the patients. I remember being upset when 9 of us were taken by the registrar to listen to bronchial breathing on a man who was dying. And I remember thinking at the time that it wasn't right that 9 medical students were listening to his chest, although I guess he didn't know anything about it. And also that other habit of gynecologists of encouraging the medical students to do vaginal examinations on the anaesthetized patients, which certainly, you know, they had never consented for. And it never occurred to me that there was anything the matter with that. We were encouraged to do procedures, putting up drips, maybe even having go at a lumbar puncture or a chest drain if you were lucky and could find someone to supervise you. And also to follow the houseman when he was on take, and there was student accommodation, and helping in theatre. Well, I don't know whether we helped much, but holding the retractor and snipping at the stitches. The thing, when my friend and I were talking about this, that I think was very useful, but actually terrifying for all concerned, was in our last year, we had a couple of months as a junior houseman where we would shadow the houseman, and we were encouraged to do locums in that time. And the supervision or lack of it was pretty terrifying. One thing I remember is with the houseman, he was on take and admitted a young man in his 30s in status asthmaticus. And I was dispatched to give this patient aminophylline. Now I knew that because I'd been taught that if I gave the aminophylline too quickly, the man would have a heart attack, he'd have some arrhythmia, and he would die, and it would all be my fault. But there was no question. I have no idea how I got hold of the drug, who checked it, but I have a very strong recollection of sitting behind the curtain in a darkened ward, injecting this very slowly. And the patient was panicking, and I was feeling pretty panicky. And it was the first occasion, I think, that I was conscious that if I paced my breathing with him and slowed it down, we would both be calmer by the end of it. And later, when I started being interested in hypnosis and NLP, I realized I was pacing. At the time, I think I just did it in order to calm myself and him. So teachers I remember, Andrew Treacher was, who taught us behavioural science, and he was great. Paul Stapleforth was remarkable for the time in that there was an orthopaedic surgeon who looked at the psychosomatic aspects of breaking a leg. So if I broke my leg, it would be a nuisance. If I was a professional footballer, it would be disastrous. John Burton, a funny dermatology registrar who turned into a funny dermatology professor. Roger White at Frenchay, I did his, I was on the firm both as a junior houseman and then subsequently as his house officer. And on Tuesday afternoons, he would do a ward round with the whole firm. And then we would go back to the mess where we would sit at a table with a white tablecloth and have tea, and he would teach us. And we were being spoon-fed literally and metaphorically, and it was wonderful. Terence Steen, a larger-than-life anaesthetist. I first met him when I was in doing almost the first time I went to theatres, and Mr. Wilson was doing an operation, and I remember Dr. Steen coming up, putting his arm around me and saying to me, "What about you, dear? Are you any good at sewing?" And I said, "Yeah, I'm all right." And he said, "What about him?" pointing to Mr. Wilson. "Do you think he can darn his socks?" And I sort of got caught up in their repartee. But what I really remember about him is when I was doing anaesthetics as a student, I went out to Ham Green for a urology list, and he was the anaesthetist. And he announced that he was going to show me an open ether method of anaesthetic. And at the time, the theatre sister rolled her eyes, and I didn't really understand why, but I think subsequently I learned that the men who were being anaesthetized would probably be vomiting for quite a long time. Anyway, he showed me the principles of the rag and bottle, and then he said to me, now, what do you do before you start? And I had to think, and I said, check its ether. Yes, you check its ether. How do you check its ether? Sniff it, I suggested. No, you don't sniff it. And he got the bottle and he shook it all over the pillow and he went, that's ether. We had a wonderful time. We were very funny. He was very funny. I was very funny. You know how it is when you've had a little bit to drink? Well, we were very funny. At the end of the day, I drove myself home. And after supper, I announced to my husband and to my flatmates that I thought I'd go to bed because I was rather tired. And apparently, when my husband came up 3 hours later, I was smelling very strongly of ether, and I slept for 12 hours. Anyway, no harm done for me. I've never used an open ether anaesthetic, but if someone needed an anaesthetic, I reckon I could do it, well, providing I had a bottle of ether there anyway. So what happened to our year? These are fairly rough figures, but I'm pretty certain of them. 142 started. Quite a lot of people failed at the end of that first year, as I nearly did. So 135 were contactable at 10 years post-qualifying. And at that time, 45% were in hospital medicine, 45% in general practice, and you couldn't actually classify the others. By our 40-year reunion, 78 were in contact, 5 had died, and of course at that stage many of us were retiring. So what shaped my career? Behavioural science. Now, did I like that and therefore I followed the career, or did it shape my career? I spent a morning in the infertility clinic with Rosalind Hinton during my gynae attachment and came away from that thinking I'd quite like to do that when I grow up. I was very grateful to the doctor's retainer scheme, which allowed me to work as a supernumerary for 2 sessions a week when I had my family rather early on. And I think I was just lucky. But it is interesting that the Institute of Psychosexual Medicine, which is based on Balint, has been one of my passions and continues to be very interesting to me. So thank you.
Thank you, Cathy. So for those of us who are storing up questions for Cathy, make sure you write them down so as not to forget them. So Cathy, you've unshared your screen, I think.
Yep.
That's great. We're going to switch over now to Mel Griffin, who's going to come in. Cathy speaking from Wells and Mel speaking from Stoke Bishop. Right, Mel, it's all yours. Anybody else can turn off there.
Just opposite Churchill Hall. I
Yes.
can see Churchill Hall out of my study window. Okay, so Cathy, that was really, really interesting. And what I found particularly interesting was some of the striking similarities of things hadn't changed a huge amount over 25 years, but I'm delighted that some of the areas that you highlighted, certainly with regards to how women are now treated at medical school, have improved. So David, thank you very much for giving me the opportunity to speak to you all this evening. As David mentioned, I'm a consultant obstetrician at St Michael's Hospital in Bristol, and I was appointed just after David retired. Sorry, just bear with me. I'm just struggling to move on to my next slide. So why did I end up coming to Bristol? Well, like Cathy, it wasn't that I went to the University of Manchester, but I did grow up in Greater Manchester. And it was a little bit of a surprise when I ended up in Bristol, because whilst I was surrounded during Freshers' Week with a lot of Oxbridge rejects, I wasn't actually an Oxbridge reject, I was a Sheffield reject. Because my first choice university was Sheffield, partly because it wasn't that far from home. But unfortunately, I needed to get an A in A-level chemistry. to get into Sheffield, and I didn't. So Bristol was my second choice. But I must say, since then, I've never looked back, and I'm delighted that I've been able to be a graduate from the University of Bristol and not the University of Sheffield. So what did I know about Bristol? Well, not a huge amount, because I wasn't intending to spend a significant part of my life here. But what I did know, because one of my really good friends was from Bristol, was that it was very hilly, and it wasn't somewhere that you particularly wanted to do a lot of cycling around. It was a long way away from Cheshire, which is where I'd grown up. And it was warmer, but rather wetter than the frozen north. And it was quite interesting, because my mother, thinking that I was going to be going to the University of Sheffield, had actually bought me this incredibly thick winter coat, but it wasn't massively waterproof. And I too was at Baydock Hall, and in our first term in first year at Bristol, I think there were 2 days in the whole of that winter term where there wasn't horizontal rain across the downs every morning, when you would trudge across the downs to get to your lectures. And I certainly could have done with a waterproof coat rather than a very warm one, because certainly umbrellas would not last for long. I just wanted to sort of start by talking about my early years really at medical school. I know that Cathy, I think, concentrated a lot more on what she learned at medical school, whereas mine is slightly different. So the first thing I commented on is that the Medics Pub Crawl. Now, this is an institution at University of Bristol Medical School. I'm not quite sure when it first started, but it is responsible for me meeting my husband, which you can see pictured there on the right. This was us dressed up during our first year for the mums and dads night, where you were matched up with people in the year above, with the idea that they were supposed to share their lecture notes with you and keep you on the straight and narrow. The Medics Pub Crawl basically starts at the top of Black Boy Hill at the King's Arms, progresses down Black Boy and White Ladies, and then the top of St Michael's Hill, and then used to end in the Ship Inn. And many happy night was made on the Medics Pub Crawl. My memories really of the medical school, the building, I now actually sit directly opposite that out of my window of my office within the hospital. And it's the same building that Cathy describes. And our lectures too were in E49 and the same lecture theatres in St Michael's Hill. The library to this day is still in exactly the same place. And E49 I have actually been back and lectured in there, and the first time I went back there, I found it a rather surreal experience, because it's the same layout, but obviously when I was at medical school, every medical student didn't have a MacBook Pro. And I looked up to start my lecture and I couldn't see any faces. All I could see was the back of MacBook Pros. And I was left with this feeling of, well, are they actually looking at my slides on their screen, or are they just updating their Facebook status? I did actually have a colleague who was sitting at the back who assured me that the majority of them were actually listening to me and editing their slides, but gone were the days of taking copious notes on paper. It was all electronic. My other lasting memory of early years in medical school was the sports trip. So I was the captain of the medics netball team, and we had many a trip to other universities, mainly within England, but there was the annual trip to Nantes Medical School, which I actually never went to because I don't think the French are that interested in netball, but certainly there were some very interesting stories that came back from Nantes. This is a picture of the famous uterus, which, as you can see, you've got the two funnels at the top, which were attached to a single tube at the bottom. And I do recall being on a trip to the University of Oxford, and there was one of my colleagues who was put at the bottom of a flight of stairs with the bottom of the two funnels, and somebody was standing at the top of this, the stairs up to this rather nice house, with two large jugs of beer, which were just about to be poured simultaneously into the top. So this was, yes, quite an interesting experience. And I think since the uterus has been banned. The other sort of memory that I particularly recall from early years in medical school was the preclinical review. This is a picture that I'd actually taken from one of my yearbooks. because, as Kathy mentioned, not many of us had mobile phones when I started medical school, and it certainly wasn't in the days where you had a phone with a camera on it. And so when David asked me to do this talk, I thought, oh, that's fine. I got loads of photos. And then I looked back and realized that I really didn't have that many photos that were electronic. So apologies for the quality of some of these, because I've had to take photos out of our yearbook and also take photos through photo frames. So one of the things that David suggested that we covered as well was who was our most famous student. And I have to say most famous student because they didn't actually become a graduate of the University of Bristol. But a guy who joined my my year at clinical was Philippe Conteponi. And I don't know whether any or many of you are rugby fans, but Philippe came across from Argentina to play with the Bristol Shoguns, which obviously we now know as the Bristol Bears. And obviously Bristol had got a reputation of getting medical students through who were good at sport, Jonathan Webb having been a multiple England capped rugby union player. And so I first met Philippe when he was on his psychiatry attachment. Very charismatic, lovely guy, who I remember as the picture in the Shogun shirt there. I obviously then went on to follow his career after he left Bristol when they got relegated, and he moved over to Ireland, but saw him playing for Argentina, and he's one of the most capped players ever for Argentina. He'd had 87 appearances and is their all-time top scorer. He'd actually played in 3 Rugby World Cups and has been accepted into the World Rugby Hall of Fame. I was looking up at where he is now, and when he moved over to Ireland, he played for Leinster for quite a long period of time, and he's now actually the backs coach. And as far as I'm aware, I don't think he's practicing medicine. He did, when he moved over to Ireland, he completed his medical training with the College of Surgeons of Ireland. I think did his house jobs, but I don't think practiced after that because he was a bit too busy being a top rugby player. I added the picture down at the right-hand side because this is a much more recent picture of Philippe. And it just cheered me up a bit because it shows that we all do age, and that made me feel quite a bit better about myself. So what happened in the clinical years? What I'd be really interested to hear from Kathy is where she actually went for her clinical years, because at the time for our clinical training, it predated the Peninsula Medical School. So we got sent out to various different units throughout the Southwest, which I think provided us a fantastic experience. And we also got to stay in some really nice places. So I did paediatrics in Barnstable, I did care of the elderly down in Plymouth. But I think one of my most memorable clinical attachments was actually my psychiatry placement in Torbay. And I've added this picture of a sort of haunted house with the lightning strike above it, because I was down in Torbay with one of my very good friends, Rhys Thomas, and basically it was over Christmas and then into January. And one of our placements was that we got to spend a day at this psychiatric hospital just down along the coast from Torbay. So we had quite a nice time driving along the coastal road to get there, but the weather closed in. And we found ourselves in the middle of quite a nasty thunderstorm. And as we arrived at this building, which looked very much like the picture here, there was literally a flash of lightning that came out of the sky. And I think Rhys and I were very concerned that we were actually never going to leave this place, especially when we were met at the door and they said, oh, and we don't want to alarm you, but for your safety, here's a personal alarm. And we thought, Anyway, we did survive the experience, but suffice to say, neither of us ended up going into psychiatry. There was even more sports throughout our clinical years. There was the clinical review, which took a huge amount of organisation. And my husband, who was obviously in the same year as me at medical school, says that this was largely responsible for him not getting a distinction in every area of medical school because he was spending too much time producing the review. I think he just needs to get his finger out, but anyway. The other notable event that used to happen, I don't know when it first started, was Clickendales. And this was basically the year strip. So it would occur in the Anson rooms in the university union. And so medical students, both male and female, would do a male and a female strip to raise money for CLIC, which is the childhood leukemia cancer charity. And that was a rather interesting evening, to say the least. Probably one of the most fondest memories I have throughout my whole medical career is our elective. James, my husband, and I were lucky enough to go to South Africa for our elective, and had the most amazing 3 months out in South Africa. There's some pictures here taken of us when we were traveling around South Africa. Unfortunately, I couldn't find any of all of our friends who were out there with us, but we made lasting friendships through our elective of people that we met both within medicine and outside of medicine, who we still keep in touch with to this day. And then there was the graduation ball. This is a fantastic event. Our first graduation ball was out in Blagden, and the second graduation ball, which I must add, that's not because I failed my finals, but because I intercalated. So I ended up going to 2 graduation balls, was up at King's Western House, and were both fantastic occasions where you really felt it marked what we'd really been working so hard on achieving. So I know that I mentioned that that our elective was probably one of the best times that we had at medical school, but it was also one of the saddest times, because one of our very good friends, Catherine Bullen, tragically died on her elective. This is a picture of Kath and Steph on their elective not that long before she died. And that was a major blow to all of us, and a massive loss to both all of the medical school community, but the future amazing career that I'm sure that Kath would have gone on and had. I know that Kathy had sort of put up a slide about where what her cohort went on to do, and I'm afraid I didn't have any significantly good stats, but I was aware of the sad passing away of 2 of our colleagues at medical school, both from cancer in their 30s, and you know, I hope that we are not going to add to that number in the near future. So memorable teachers. Well, I really think this is the main reason why David asked me to speak, because as he mentioned, he taught me. And when I was in my 4th year, and he was the reproductive health and care of the newborn lead, which is actually the post that I now hold, he was indeed a great inspiration, both to myself and my husband. My husband actually chose not to have a career in obs and gynae, but David inspired me to go into a career in obs and gynae. And he's a fantastic teacher. And the thing that I loved about obstetrics and gynecology in particular was the great variety within the specialty, and that it was so hands-on and practical. And I think that a lot of our students, that's one of the things that they particularly enjoy about their attachments in RHCM. The other people that I really remember are Jeff Clark, who was our preclinical dean, who was the head of anatomy. Jeff was also my husband's mentor, and was a massive support to both of us throughout our medical career. As a further link, his wife was one of the lead pharmacists in St Michael's. And it was really nice that until her retirement, I'd continued to see her within the hospital, and she'd always be asking about how we were doing. I've said memorable teachers, but the other person who was particularly memorable was Wendy Hammond, who coordinated all of our RHCN teaching, and was just an absolutely amazing person at orchestrating what was a really quite complicated timetable. One of the other people who has got a really clear memory of is Clive Roberts, who was the clinical dean. And I'm sure he used to market himself as the only clinical pharmacologist, certainly in the region. I then wanted to go on to mention Karen Forbes and Nigel Rawlinson, because they both taught us a lot in 5th year. They were both massively supportive when we all came back off our electives after Kath had died, and were really truly inspirational, not only in their teaching, but the amount of support that they provided to all of the medical students. And then finally, the other person that I've just put on this list is Martin Gargan. Now, Mr. Gargan, as he was known as when we were all students, was, again, a fantastic teacher. He was the first person that actually made me really understand what the surgical sieve was. and was a really, really just engaging person who really got us and really interested in orthopedics. I must say the orthopedic X-ray meetings were just hysterical to be. Also helped by the fact that the Hand Fellow at the time was Mr. Hand, who was in the Navy, who is an incredibly amusing individual as well. And it is quite funny how things sort of cycle round, because Martin Gargan is now my divisional lead for women's and children's. So when I was preparing for my consultant interview, he'd just come into post. And one of the good or bad things about having red hair is that people quite often, they normally remember you. You kind of always hope that's for a good reason, but occasionally not. But on this occasion, it seemed to be for a good reason, and I think probably helped me in securing my post. So where is everybody now, or what have they been up to? Well, a lot of us are consultants and GPs in the Southwest, but not all of us have stayed in medicine. So one of the guys in our year now runs a large pharmacy chain that he'd set up in the north of England. And Kate Hebden-Britton, who's pictured here, she went off and integrated in anthropology and never came back, and is now a TV producer and documentary and filmmaker, and has a very interesting and glamorous life. The guy pictured to the right here is Matt Edwards, who's a good friend of ours, who is an emergency medicine consultant. And Matt went off and spent 18 months in Rothesay as the doctor on the British Antarctic expedition, and has got some absolutely amazing stories of his time out there. He's also done a lot of flying doctors, and there's this picture of Matt I think taken during his time working at HEMS, but has worked with flying doctors in sort of war zones, particularly in Africa, and has lots of good stories. There's also a lot of us who've ended up going onto the television. Just to name two of our years, so Claire Taylor, who's a GP in London, was on GP Behind Closed Doors. And my husband was reminding me that Dan Bowden, he happens to be flicking the TV on one night. He went, oh God, it's Dan from medical school, who was on Hospital, which I think was a programme at City Hospital in up in Nottingham. And I think there's been a lot of other TV experience that some of the other people who graduated in my year have gone on to have. Obviously, One Born Every Minute has been filmed in Bristol, was up at Southmead, but I don't think there was anybody from our year who was featured in that. So I then sort of thought about, well, what did I really achieve at medical school? Well, I think the most important achievement was actually graduating, because I think it's very easy to underestimate actually how difficult it is to get through a medical degree. And for those of you who are eagle-eyed, will realise that actually this picture isn't of me graduating in medicine. This was my graduation for my integrated BSc in microbiology. I couldn't actually find our graduation photos. But that really was and still sticks with me, even beyond thinking about membership or award of higher degrees, was just such a special day. And I must say, I've been lucky enough to attend a few of the medical graduations since I've been in my post as lead for reproductive health and care of the newborn. And it's a very, very special day. And I did particularly enjoy where there's always the acknowledgement of the support that you have behind you to get you to that point, whether it be family or friends. It's very, very difficult to achieve that by yourself. The next thing I put up, slightly tongue-in-cheek, is finding a husband. So as I said at the start of my talk, my husband James and I met on day 3 of medical school on the medics pub crawl, and we were known rather cringingly as Gel at medical school. So at the end of our 5th year, he eventually plucked up the courage to propose, and we were married at the end of our house jobs. But one of the reasons why I put finding a husband up there is poor James got dragged along to watch Titanic when it came out, and we went to what's now the Everyman Theatre on White Ladies Road, and he was one of only 2 men in the auditorium. I think the other guy was looking similarly unimpressed at being there. But it was all worthwhile for him going for the bit in the film, and I don't know whether any of you've seen or remember Titanic, where it's stated, well, the only good reason for a woman to go to university is to find a husband, and the whole of the auditorium was this massive gasp, apart from my husband and this other guy who were having a little snigger. So yes. But what else has been achievements from medical school? Well, it's got to really be the long-term friendships, both in medicine, but also the other friends that we met through the university. This is a picture taken from our wedding day, and there's quite a lot of medics in this picture. So Dave Lewis is now a haematologist down in Plymouth. Warren Grants is an oncologist in Oxford. Rhys Thomas, a neurologist up in Newcastle. Dan Hirsch, a GP in Bristol. Matt, who I've mentioned before, who's an emergency medicine consultant in London, and James, my husband, who's a haematologist in Bristol, and Mark Edwards, who's our best man, who's a rheumatologist down in Portsmouth. And just the photo on the left is Rhys and Dave, who were my medic housemates, and I think we had such a good camaraderie. That is what got most of us through medicine, and certainly it's been a lasting friendship group that if you're having a hard time, there are always people that you can rely and call on, even if you've not spoken to them for a long period of time. But I think the most important thing about medical school really was just having fun. So I just wanted to finish, when I was preparing for this talk, as I think I mentioned at the start, I managed to find our yearbooks, and Laura Gosling was our Glenical's president in the year that we graduated. And I was just flicking through the yearbook, and it really did bring back lots of amazing memories, but this was what Laura had written in the yearbook. So in 20 years' time, which is essentially now for my year of graduation, when a handful of us are top consultants, half are GPs, and the rest have either packed it all in to bring up Sprogs or move to Oz because the sun shines there, how will we remember our days in Bristol? When we have students on our firms, will we be the brilliant student-friendly docs that we all vow to be, or will we peer down our noses and inquire, what do they teach you in medical school these days? Do you really learn anatomy? I think some of us might have been a bit guilty of having those thoughts. So year after year, we were humiliated on consultant ward rounds. Doesn't sound that dissimilar to what Kathy was saying earlier. And in return, we slated our teachers as we danced and sang in the clinical review. And somewhere along the way, we must have learnt some medicine, because here we are about to become doctors. Half of me thinks we haven't changed a bit. But then I think about a lecture from Mr. Hardy last week. The entire year was there at 8:30 on a Friday night. Nigel Rawlinson gave us one at 5 p.m. on a Friday in the third year, and 20 people came. And I think really that showed how we matured and blossomed through our time at medical school. Thank you very much. I hope you've enjoyed the talk, and happy to take any questions.
Great, Mel, that was wonderful. Thank you. So if you can close and unshare your slides, that would be great. So people can now unmute themselves and turn on their cameras as well, and maybe gather your questions together. I have a question for Kathy, I think, really. Kathy, you got married to some Northern Irish guy as a student.
Yeah. Mm-hmm.
Excellent person, of course, that he is. But would you recommend to a medical student, be they male or female, that they get married as a student? Or do you think, was it helpful and useful to you, or was it a distraction? There are always benefits and non-benefits, whatever the opposite of benefits are. I can't remember, but how does it balance out, do you think?
Well,
sorry about that. Hard question.
I don't think it was the getting married. I think it was meeting someone who's important to you that's highly distracting. And that was where I nearly came to grief at the end of the first year. I don't know. I've never regretted it. And But I mean, times are different now. If I think about my children's generation, they're together for years and years and years, and they may or may not get married. They get married if they think they might want a family. You know, so I think that, you know, life is very different socially. I was chatting to Mary McGraw, who was a very good friend of mine. You know, I'm still very good friends with, and she said, "Oh well, we just never thought it would last." You know, we were laughing about it. So I don't know. Advice to my, if I had to give advice to my younger self, I'd probably say, well, you might as well get on with it, really. Yeah.
Okay, that's given other people hopefully a chance to gather their thoughts and consider. So anybody feels, so I would suggest that if you have a question, just unmute your microphone and speak slowly and clearly.
I've got a question for both of you, which is how much competition was there for seeing patients on the wards? Were you actually able to wander around on the wards and see people, or was it very much shepherded and herded on the selected patients?
Shall I speak first?
Mm-hmm.
I had, we had pretty good unfettered access to the patients. They, poor things, were sitting ducks, really. They were lying there in bed. I mean, we would ask, and I think we had to ask the ward sister if it was all right to speak to them, and we would also then ask the patients if it was all right. And most of them were very happy to oblige, really.
Mel?
Yeah, and certainly, I mean, I think as I mentioned in the talk, I was about 3 years before the Peninsula Medical School started. So we were all really quite spread out. So there weren't loads of students around in each of the hospitals. So there wasn't a huge amount of competition to see patients. One of the lasting memories that I do have, though, is the assumption that because you're female, you're a nurse. And certainly in the older generation, that happens still a lot. And it's interesting, though, I mean, less so, I guess, in the social circles that we move in, but still now, if you're speaking to somebody who doesn't know you at all, it's like, oh, right, so you're a nurse then. And it's like, well, no, actually, I'm a doctor. And that doesn't really bother me, because I think that nursing is an incredibly important profession. But there is still sort of like those stereotypes around, but I never felt that sort of hindered my sort of access to getting as much training as I could. And it's a bit difficult because there's always that fine line between what's acceptable banter and what oversteps the line. And I think, you know, in this day and age, you've got to be incredibly careful of what you say and how you say things. But I think that has meant that that there isn't as much of a camaraderie between some of the firms that you would be on and the medical students.
Well, I thought that description of the uterus you guys had with the beer, I thought it was probably then stolen by the CIA to use for waterboarding. It looked like a very similar technique to me.
Yeah.
I hope they got a lot of money for it.
Yeah, there was actually one of the things that I didn't mention, which my husband did remind me that I should. So a good friend of ours on a similar medics trip, who was doing his clinical at the time, and they were doing flaming sambucas, and the glass was metal rimmed, and so they were supposed to be putting the flaming sambucas out on their forehead. So he did this with a glass with a metal rim. So he ended up with this big sort of circular, especially on his forehead. He had very short hair, so there wasn't really any disguising it. And so anybody he saw on the wards, he was like, oh yes, I had this awful accident with the end of a scaffolding pole. I just didn't see it.
Yes, well, the truth is stranger than fiction.
Could I inquire, to what extent were patients involved in their treatment, and how well were they sort of understanding what was happening to them? Because certainly when I was a student, it was more or less the object at the end of the bed rather than somebody, a real person. I was hoping that there was much more personal approach in your training.
Thank you, Victor. So Kathy first and then Mel, if that's okay.
Yeah. I don't know. I do remember people explaining to patients what the treatment could be offered. And, you know, there was no obligation to have it. I think they'd sort of changed to that extent. But it was still okay for, you know, whoever was taking the consent to say, actually, that's what I would do if I were you.
I mean, I think that's one of the areas that's changed a lot. So we would very rarely go and see patients in groups of more than 2. So quite often, if we were, you know, wanting to practice clerking patients, then we would go with another medical student, especially when we were third years and quite scared. And ironically, obviously, now medical students, it's always recommended that they go and see a patient with a chaperone, as I always offer a chaperone with any patient that I see. And certainly if we were having like a teaching ward round, patients would be approached beforehand to check that that was okay. And quite often, if it was a planned, like not like a post-take ward round, but an actual planned teaching ward round, then the consultant would have gone around and selected patients before and gone to see those patients and checked that they didn't mind. And I do remember, you know, sort of you'll have the odd patient who's got like an absolutely cracking heart murmur that everybody wants to listen to. And by the time you're revising for your finals, it's like, oh, did you hear Mr. So-and-so has got a so-and-so, go and have a listen to it. And we were all acutely aware that Mr. So-and-so was probably having this listened to for the, you know, nth time. And actually the nurses would be very good at saying, we'd always go and speak to the nurses first, which, you know, I think he's actually quite tired. Although I must say, I think occasionally patients do actually quite enjoy being celebrities. And sometimes are quite proud of some of their signs and symptoms. But we were acutely aware of that. And also it was during so it was the time when I was a clinical medical student that Kathy said about intimate examinations, particularly in obs and gynae. And it used to just be that people would rock up on a theatre list and it would be like, oh, right, just examine the patient. And it was during that time where it's like, actually, this is not acceptable. And there was a real change. And we all used to take documented consent for examination under anaesthetic.
Thanks, Mel. Anybody else got any questions?
What proportion of the medical students were female?
So I know Kathy answered this on her slide, but I didn't, and I actually meant to say, so my year was, I think Kathy said hers was 45 female, so it was 55 male. We were 70-30, 70% female. Now, it's quite interesting because as we've gone on, this is, I mean, as you've probably seen, because it's been well documented in the press over the last 20 years, the problems in medical training and women going off and having career breaks mainly for maternity leave, and the impact that has on workforce planning, which has been really quite interesting. I think after our year, it actually went even more so. And I think the most extreme, David will be able to correct me if I'm wrong, at Bristol was 80-20. And I think now it has gone more back to, I think it's about 60-40.
In favour of men? Or
no.
Still
women.
in favour of women. But I think the other really interesting thing about that, Peter, sorry for butting in, but the other interesting thing is that when you look at the proportion of men and women in established jobs in hospital or in primary care, the figure is nothing like those 70-30 type numbers that we see in student populations. It's much more like 55-45, and you know there appears to be a huge loss in women, whether it's because of Mel said people going off to have children, but but it seems far more than that. It's I think, and where they all get lost or whatever. I don't know, whether they maybe all go to Australia. It's hard to know. Okay, we're getting close to the end. Kathy, I had one last question because Mel told us what people died from. So you had 5 people in your year who had died at the 40th reunion time. So what did they die from?
There were 2 suicides, one as a student and one in her early 30s. 2, possibly 3 brain tumors and renal failure. Those are the ones I knew about, yes.
Right. Okay, thanks. I mean, I think that sort of the cancers and the suicides are probably ones that will happen a lot.
Yeah.
Okay.
It's Norman Trix. Can you hear me?
Yes, we can, Norman.
Yes, in our year, we had 1 die of polio and 1 of TB. That was in 1945, 46.
Quite different. But that, Norman, if I remember from our conversation yesterday, that was while they were still in medical school.
Yes.
Yes. So I think Kathy's figures and Mel's figures are for 20 and 40 years afterwards. So for people to die as students, I mean, Mel talked about that girl, Catherine Bullen, who died as a student in Africa. But that's rare. But for 2 people to die, and you had a class of 45?
Yes.
So for 2 people to die at the age, at that age, a very young age, out of 45, that's a very high proportion to die from various infectious diseases. Thank you, Norman. So I think we've exhausted people's ability to ask questions, and we may have exhausted our speakers' ability to answer them. So I would like to, I'd like to close by thanking both Catherine and Mel for giving up their time, not just tonight, but for the preparation work they put into this. It's been enlightening to hear what they've said. I have particularly found it useful, but I hope everybody else found it helpful and useful to kind of look back over the old days, as it were, from a slightly objective stance, as it were, and it's been I really enjoyed. My microphone was switched off, but I did giggle once or twice during some people's presentations about little bits of stuff they said, but thankfully none of you heard me, because that would have been inappropriate and unbecoming a gentleman or whatever. Anyway, so thank you very much, everybody. We'll be meeting again in June, I think, and listening to, we will be meeting in June. I'm not sure whether it's this day, 4 weeks time, as it were, but it's around then. And we'll be hearing from Mel, from Pip Mills, ex-gynecologist in St. Michael's, Jane Sampson, who is still working as a dermatologist, but is also the deputy of the medical school at the moment, and a woman called Liz Cutt, who was a radiologist in the BRI, then moved to Southmead and has just retired. So we'll be hearing from them on their stories from their time in medical school, all in Bristol. So thanks very much, everybody, and good night. Safe journey home, down the stairs or wherever you're going. And thank you very much for joining us. Bye-bye.
Bye-bye. Thank you.